Sachin Gupta is the CEO and founder at IKS Health, here to talk a little bit more about the company's plans for an IPO, the outlook on business as well. Thanks so much for taking the time out. Now, given that this is the first interaction that we're having with you, let's understand the business a little bit more. What exactly is the business model, and over the last 17 years, how has the journey been? How have you evolved?
So IKS Health was founded about 17 years ago to solve some very important structural issues in US healthcare. As you know, US healthcare is the largest industry in the world, about $4.6 trillion as we stand today, growing faster than the US economy that is slated to be becoming $7.1 trillion. US healthcare will be $7.1 trillion by 2031. And it is plagued by three very, very important structural problems. One, cost, of course. At 20% of GDP and growing faster than economy, the cost of healthcare is just too high. Second, there are some real issues around quality. You know, national statistic now, Johns Hopkins just published a study that there are 250,000 patient deaths that happen annually in the US that can be attributed to medical errors. This is predominantly because the providers that provide care are overworked with all sorts of administrative burdens. And the third is access. The third structural problem is as the population ages in the US, which is a phenomenon of the West all over the world, the number of people that are there to provide the care are just not growing at the pace of which number of people are there that need care. And that creates this demand-supply imbalance that leads to access issues. Again, the statistic is the average wait time for a new patient to see a physician is 26 days. So when you confluence these three problems of cost, quality, and access, there needs to be some structural interventions. IKS over the last 17 years built a business model that through the right confluence of our own proprietary technology and our global human capital essentially is centralizing and delegating what I call chore tasks within these healthcare provider enterprises.
Right. Sachin, you announced an acquisition in the US as well to fuel your growth. Tell us a little bit more about it.
Yeah, so I think, like I was saying earlier, the amount of money being spent on these tasks in US healthcare across the physician group clinic setting and the hospital setting is more than $250 billion. We do these tasks through a combination of our proprietary technology and our people, maybe about 20% cheaper. So that creates for about a $200 billion plus total addressable market. Now equate that to an industry that we're very familiar with, let's say the IT services industry. In 1998, IT services was about $5 billion. In 2010, it had gone from $5 billion to $100 billion. In 2022, it's sitting at north of $200 billion. We believe that because of these structural issues in US healthcare around cost, quality, access, it is going to be a similar unlocking of the $200 billion TAM that I just spoke about in a manner where this TAM is going to get unlocked. And we believe that with IKS and Acuity coming together, we have created a unique platform that truly has the ability to take significant advantage of this unlocking of the TAM. Together today, we are a $330 million company. As some manifest of this $200 billion unlocks over the next, say, 2 decades, I think it creates an immense growth opportunity. Also, between Acuity and IKS, today we have probably the most marquee clientele in US healthcare. Some of the biggest, most successful health systems, some of the most marquee physician groups. And so with that kind of a captive install base, as we cross-sell our products across our 2 install bases of 500 plus enterprise scale clients, we feel very optimistic about our ability to be a very significant player in this macro secular multi-decadal on unlocking.
All right, and given that you're an Indian company which has a big presence in the US healthcare market, how are you looking at the Indian and US market dynamics? How are they different from each other?
I think at some level, my belief is that the same problems that are plaguing US healthcare will potentially create challenges in India. But I think we have some ways to go simply because India is predominantly a young country. So, you know, our average age is in the 20s. I think it's 27 or 28 years. And so the reality is that between that average age and our demographics being younger, and the fact that, you know, the Indian healthcare industry is still maturing in terms of leveraging health insurance effectively. As I understand, health insurance in India today doesn't even often cover ambulatory or clinic-based care. So I think as some of those structural changes happen, Per capita GDP goes up from $2,500 to $10,000 as we become a $10 trillion economy. I think the reality is many of these issues that we are struggling with in US healthcare will perhaps be evidenced in India as well. And so we'll be watching very carefully for how that evolves. And as that evolves, a lot of our learnings from what we would have learned in the US healthcare market, trying to solve for these three fundamental issues of cost, quality, access, will have their own applicability in India as well.
Right. But your company is pre-IPO bound as well. By when can we expect that to hit the market? And how far are you already in the process?
Well, yeah. So look, I think as I described, we feel like we are trying to build an institution, a multi-decadal institution that truly has an impact on moving needles on this cost, quality, access issues, right, in US healthcare. And so we look at the IPO possibility as an important but mere milestone in our journey. What perhaps makes it somewhat important is that our mentor and my friend philosopher guide, Mr. Rakesh Jhunjhunwala, who helped us create this company and gave us the courage of conviction in this mission, that was sort of his dream. So obviously, as a part of this journey, we will pursue it at the right time, and as we embark on it, we will talk about it more.
All right. And given that the street estimate is that the value of the company is pegged around 25,000 crores, can you give us a sense? Is that close to the actual number?
I'll say, Matt, that Rakesh Bhai has taught us that valuation is a byproduct of the value we create for our customers, for the community. And so if we are truly creating value in such a large industry, I think the valuation will take care of itself.
Right. Ace investor Rakesh Jhunjhunwala has also supported you all throughout. But that has been, just wanted to understand, considering we always remember him so fondly, and since you did mention him, what's been your biggest learning from him and for your organization as well? Anything that you would like to share?
Yeah, I'll say, look, we would not be a company at all if not for his vision and his partnership, his capital, and the courage of conviction that he gave us when we were starting out, when we were in the doldrums trying to figure out whether this model will actually be viable or not. So I think his contributions here have been absolutely invaluable. But most of all, I think what he taught us is don't take shortcuts. Focus on customer value, because if you're building customer value and trying to solve such a large structural problem, if you build customer value, the rest will take care of itself. The other thing that he taught us was building a business has a lot to do with frugality. So it was large market, solving a difficult problem in an easy way, doing it frugally, and doing it with the best standards of corporate governance. That is what he has taught us over the years, and that is what we continue to imbibe and hope to imbibe over the next several decades as we build this institution.
Thank you for giving us more of an insight into the company and how operations are shaping up.